Hello everyone, myself M. Janet, lecturer, Faculty of Physiotherapy, Dr.M.G.R. Education and Research Institute. So today we are going to discuss about the derived portions. So these are the portions which are derived from the starting portion. So you have 5 fundamental derived portions like standing, sitting, lying, kneeling and hanging. So these positions, it can be altered depending upon the patient convenient as well as the therapist convenient, and this is usually performed to perform the particular activity or the movement. So the common uses are to increase the stability, to promote the relaxation, to reduce the muscle work and to perform the particular activity. So the first derived fundamental position is standing. So in standing, the total body is supported and aligned with the smaller base. So in standing, it cannot be adaptable for a longer period because you need a lot of coordinated muscle activity to maintain this posture. So in standing, for this you will make the subject to stand straight. So in standing, so the subject are made to keep their feet much closer and toes are slightly apart and knee are kept aligned straight and hip it has to be in the neutral position and slightly radially rotated, and knee it has to be extended and aligned straight, and spine it has to be erect, okay, and upper limb it is hanging closely to the body, and shoulder it should be adducted and slightly retracted, and neck it has to be aligned straight and eyes should look forward. So this is the basic standing position which is adopted in the standing posture. Okay, so you have different types in standing like high standing, walk standing, stride standing, step standing, half standing, toe standing, lunge standing and cross leg standing, and you have some other on foot standing positions too. So the first one is the high standing. So in high standing, you will make the subject to stand on the stool or any raised platform. So this position is mainly used to perform the upper limb and lower limb exercises, and it can be used for the hanging and swinging the arm and the leg. So the next position is the walk standing. Next position is the walk standing, so in which the subject are made to place one foot forward, okay, so in which the base is increased and it promotes more stability in maintaining this posture. So it is mainly used to promote the relaxation after prolonged standing, and it gives the self stretching to the hip, knee, ankle and trunk muscles, and it gives and it can be used as a jogging in the starting position. So the next one is the stride standing, so in which the subject feet are kept wide apart, okay, on the side base, and this position is mainly used to promote the lateral stability, and it promotes the stretching, or it can be used as the performing exercises over the hip, knee and trunk muscles. So the next position is the step standing, so in which the subject are made to place one foot on the stool, okay, so in this position in which the hip and knee are flexed, okay, and it can be mainly used to perform the stretching to the hip, knee, ankle and trunk muscles, and the foot it is placed on the stool. So the next position is the half standing. So for this you will make the subject to stand on one leg, so that leg is totally flexed. So this is mainly used for giving the weight transmission exercises, and balance and coordination exercises can be performed. Next position is the toe standing. So for this you will make the subject to stand on the toes. So these toes raises the body, so in which the base of support is decreases and COG it increases. So this position is mainly used to give the strengthening to the plantar flexors and toe extensors, and it gives stretching to the dorsiflexors. So next one is the close standing. For this you will make the subject to stand straight with their feet much closer, and the hands are placed on the side of the body. So this position it cannot be maintained for a longer period because it creates the tension in the leg muscles. So this position is mainly it is used to perform the upper limb and lower limb exercises, sit-up exercises and arm swinging exercises can be performed. So next one is the lunge standing, so in which both the feet are kept right angle to each other. If the forward leg bends, then the weight is transmitted on the same leg. So this portion is mainly used to perform the weight transmission exercises, and balance and coordination exercises can be performed, and it gives the stretching to the lower extremity. Next standing portion is the cross leg. So subject are made to stand on the cross leg, so in which the weight, one leg it is kept flat, in which the weight is bed, and the other leg it is kept crossed to the supporting leg. So this position is mainly, it promotes the relaxation, and it can be used for maintaining the balance and coordination exercises. Next one, you have the other on foot standing position like wing standing, bend standing, reach standing, yard standing, cross arm standing, and heave standing. So the first one we are going to see about the wing stand, in which the subject are made to stand straight, and they were asked to place both their arm over the pelvic region on the either side. So this position is mainly used to perform the trunk bending movements, and all can be performed. Next one is the bend standing. So for this, the subject, both the elbows are kept in the flexion, and the hands are placed on the same side of the shoulder. In yard standing, both the upper limb are kept on the sides, and it kept perpendicular to the side of the body. So in which it can be performed, the arm swinging exercise and all can be performed. Next position is the cross arm standing. So for this, the subject's elbow, it has to be flexed, and the hands are placed on the opposite side of the shoulder. The next position is the reach standing. So for this, you will make the subject, okay, the subject hands, it has to be kept right angle, and it has to be placed parallel to the body. Next position is the heave standing. So in which the subject arm and the forearm, it is kept 90-degree flexed, and shoulder it is kept abducted, and they can be used for the rotational exercises, and the forearm it can be used for the performing supination and pronation movements. So the second fundamental position is sitting. So in sitting, the subject are made to sit on the stool or on the couch, okay, so in which the leg and thigh are kept relaxed, and then the foot it is placed on the floor, and from the trunk to the head it is same like the standing position. So for this, the base of support is increased, and COG it lies down. So you have different types in sitting position like cross sitting, side sitting, crook sitting, long sitting, stoop sitting, and straight sitting. The first one is the cross sitting. So for this, the subject are made to sit with the cross legs. The subject are made to sit with the cross legs. So in which the weight is transmitted on both the side of the hip on the either sides. So this position is mainly used to perform the breathing exercises to relieve the symptoms of respiratory distress, and it gives the stretching to the hip adductors. Next position is the side sitting. So for this position is only possible on one side cross sitting. So suppose in right side sitting, the right side of the hip it is kept like a cross like sitting, and the left side of the hip it is kept flexed, adducted, and medially rotated, and the weight is transmitted on the right side of the hip. So this position is mainly used to perform the mat activities, that is from progression from prone to sit, and it can be used to perform the trunk exercises. Next position is the crook sitting. So for this, the subject hip and knee are flexed in, and the foot are placed forward while resting on the couch. So this position is mainly used to perform the breathing exercises and mat activities. Next position is the long sitting. So for this, the subject hip it is flexed forward, and knee and ankle and foot the knee it kept extended, and the foot it is placed on the couch. So this position is mainly used to perform the hip rotational exercises, and knee and ankle exercises can be performed. The next position is the stoop sitting. So for this, you will make the subject to sit on the stool in which the trunk is leaned forward. So this position is mainly used to promote the relaxation to the back muscles, and it can be used to perform the back and neck massage. Next position is the straight sitting, so in which the subject hip are kept abducted and the foot it is placed on the either side of the stool. So this position is usually used to perform the leg swinging movements and upper limb exercises and trunk bending exercises can be performed. Thank you.